Hello, my name is Aaron. I'm the leader of Group 7. So for today, my group about to present our work about Parkinson disease. This is the content my group about to present. For the abstract, as we grow older, especially when our age is over 50 years old, live without any disease is our greatest dream, where we can enjoy our life freely from any medical related and live without suffer from any pain of the disease that in our body till the rest of our life. But because some of the disease exact cause are still haven't been found or be proven by medical experts, the chance to detect or to prevent it in our body is nearly impossible. Parkinson is one of the diseases that the exact cause never be conclusively proven by medical experts, making us interested to study the disease because of how the disease is so common throughout the world, that making the disease the world's second most common neurodegenerative disease after Alzheimer's disease. Noraisa will explain the introduction.
Parkinson's disease is a neurodegenerative disorder comprises 5 stages and commonly occurs because of a progressive decline in the structure and function of the central nervous system and the peripheral nervous system. A British neurologist, William Gowers, discovered that males are more vulnerable to Parkinson's disease compared to females. James Parkinson first named this disease a shaking palsy, but the term was suggested to be modified by a French neurologist, Jean-Martin Charcot, in the 1870s to honor James Parkinson for his noble contributions. Jean-Martin also identified that not all Parkinson's patients have a tremor. He declared in his complete description that patients will encounter difficulty in carrying out ordinary activities before rigidity develops, and it is related to another cause. Felix Vicdazir, Paul Oscar Bloch, and George Marinesco discovered the possible connection between the basal ganglia and Parkinson's disease after performing an autopsy on a tuberculosis patient who suffered from unilateral Parkinsonian tremor in 1786. Edward Bressoux constructed a hypothesis in 1895 that highlights the main point of substantia nigra as the major pathological site of Parkinson's disease.
Dying will continue the research of this disorder.
There are tons of research regarding this disease. Parkinson's disease can be categorized as one of the most common neurodegenerative movement disorder. Statistics provided from Europe that shows the prevalence and incidence rate for this disease are estimated accurately at 108 to 257 per 100,000 and 11 to 19 per 100,000 per year, respectively. In most patients, the etiology of this patient is practically unknown, but the causes of the different genetic have been identified. There are also nearly 1 million of people that will be living with this Parkinson's disease by 2020 in America and 1.2 million by 2030, provided by United States of America. There are approximately 60,000 Americans that are diagnosed with Parkinson's disease each and every year. It is also reported that the incidence of Parkinson increases with age, but an estimated of 4% of people that are diagnosed with this disease are not in their 50s yet. In the United States alone, it is estimated that the combined direct and indirect costs of this disease, including treatment, loss in income, and social security payments, to be 52 million per year. There are also statistics provided by Parkinson and Foundation Prevalence Project. It has been reported that depression is very common among patients with Parkinson's disease. This is due to the fact that the presence of either disease increasing the risk of another. A substantial amount of participants in a cohort of 23,180 with 4,634 patients with depression and 18,544 control patients reported that patients that are diagnosed with depression were 3.24 times more likely to develop Parkinson's disease rather than the control patients. It is also reported that the odds of having depressions in patients with Parkinson's disease was 2.5 times greater.
For now, we continue to explain the diagnosis of this disorder.
Of neurodegenerative disorder where it was one of the toughest disease to cure. There is no definite test to diagnose this disease. So, The disease must be diagnosed based on clinical criteria with a careful medical history, early symptom, family history, and current concern. The first step to determine whether the patient has Parkinson's disease or not are: the patient needs to have Parkinsonism, which is bradykinesia, tremor, and rigidity based on clinical diagnosis. The bradykinesia need to be present with at least one of the others too, but other examination features can also be helpful. This is because Parkinson's disease is an asymmetrical condition. Next, when the history and physical examination characteristics of Parkinsonism are verified, the clinician remove features potentially suggestive of atypical Parkinsonism, which is red flag symptom, and evaluate the patient response to levodopa to confirm Parkinson's disease. With the use of PET and SPE-CT scan, it can specifically assess the metabolic activity of dopamine transporter in the basal ganglia, and with the DET scan being a standard proprietary variant of this study. For more understanding during the diagnosis period, please refer the poster that have been prepared.
Shaira will explain the causes and the signs of the disorder.
For the causes of Parkinson's disease, as stated by Michael J. 2017, Parkinson's disease can be caused by complex genetic variations according to research. Certain gene mutations, on the other hand, tend to increase the likelihood of Parkinson's disease, but the risk of Parkinson's disease remains relatively low for any of these genetic markers. Besides that, Mayo Clinic stated certain contaminants or environmental factors like the residents, pesticide toxicity, and other environmental risk factors can raise the risk of developing Parkinson's disease later in life, but the risk is minimal. Low urate levels in the blood serum are related to a greater risk of Parkinson's disease. It also exacerbated by a mix of genetics and environmental factors. While certain forms of Parkinson's disease tend to be inherited and a few may be linked to particular genetic defects, the disease appears to strike at random and does not exist in families in the majority of cases. Many scientists already agree that Parkinson's disease is caused by a mixture of genetic and environmental causes, like toxicity exposure. The signs and symptoms of Parkinson's disease. Affected individuals can have minor tremors. When your hand is at rest, it may shiver. These tremors can make it difficult to carry out daily tasks that involve fine motor control. In the early stages of the condition, tremor normally affects only on one side of the body. Moreover, bradykinesia, which is slowness of movement. Parkinson's disease slows the mobility over time, making routine movements more complex and time-consuming. When you walk, the steps will become shorter and your feet will lag. Bradykinesia is the most disabling complication in Parkinson's disease, causing problems with daily activities. Besides that, the signs and symptoms of Parkinson's disease is rigid muscles. Rigidity is asymmetrical in the early stages of Parkinson's disease, and it affects the muscles of the neck and shoulders before the muscles of the face and terminus. It usually affects the entire body as the condition progresses, limiting one's ability to travel. Last but not least, Mayo Clinic and Spears stated that sleep becomes much more critical for people with Parkinson's disease, as the body needs more time to recover and rebuild itself. Sleep disturbances are a symptom of Parkinson's disease and may be exacerbated by drugs. Not surprisingly, more than 75% of people with Parkinson's disease show sleep-related effects.
Arlene will explain the medication and the treatment of this disorder.
For medication, Parkinson's disease has no cure, but medication are provided to help control the symptoms. It helps manage the problems with their motor symptoms. It has been found out that the people that have Parkinson's disease have low brain dopamine concentration, which means most of the medication provided mimics the dopamine or increases the concentration of dopamine in the brain. These are some of the types of medication that are prescribed to patients with Parkinson's disease. Carbidopa-levodopa is the most effective medication for Parkinson's disease, specifically to control conditions such as slow movements and stiff body parts. Dopamine agonists acts differently, where it mimics the dopamine effects in the brain instead of passing into the brain, which levodopa does. Anticholinergic agents are used mostly on younger patients because of the low efficiency but high risk of gastrointestinal and neuropsychiatric effects. This medication is used to help ease tremors and maintain cognitive functions. COMT inhibitors can be taken with levodopa to increase the effectiveness longer by blocking an enzyme called monoamine oxidase, then breaks down the dopamine. And lastly, MAOA inhibitors inhibit the brain enzyme to prevent it from breaking down the brain dopamine, which helps the brain to have a higher concentration of dopamine. For treatments, doctors recommend their patients to live a healthy lifestyle to ease the symptoms of Parkinson's disease. This change of lifestyle includes healthy eating and exercise. Therapy is also another option for treatment in Parkinson's disease. It is recommended that patients with Parkinson's disease refer to a physical, occupational, and speech therapist. Surgery is also an available treatment for Parkinson's disease. Deep brain stimulation surgery involves implanting an electrode on a specific area on the brain, which is on the subthalamic nucleus or the globus pallidus interna. The electrode that connected to a generator implanted to the patient's chest sends electrical pulses to the brain to reduce Parkinson's disease symptoms.
In conclusion, just like the slide mentioned, everyone should not let people who are affected by Parkinson's disease feel depressed or feel like a burden to anyone, because they also don't want the disease to affect them. That's why we should give them constant support and attention. The World Parkinson Coalition is a non-profit organization that will support patients with Parkinson's disease, and many organizations and associations around the globe that will help to build a better, connected, and more effective Parkinson community. And Malaysia also has a Parkinson support that will help people with Parkinson's disease. That is Malaysia Parkinson Disease Association, known as MPDA, that was formed by a group of people with Parkinson's disease and career in the capital city of Kuala Lumpur in 1994. Parkinson's disease is a disease that will change your life forever because it will consume your life, your time, and your financial for the rest of your life. It will be much worse if the disease is inherited by your family or the fact of your bad lifestyle when you were young, making it impossible to get rid or avoid the disease from your body. Plus, the medication to fight the disease is still not available, and the only function of the disease medication is to control the symptom of the condition. However, because the world is getting more advanced and more research about the disease will be done in future, technology that will cure patients with Parkinson's disease will be available and will be more effective to fight the disease in the future. Thank you for listening to my team presentation about Parkinson's disease. Thank you.